Earlier this month, the FDA approved a new Alzheimer's drug that some say offers the latest and greatest hope so far for meaningful treatment of this costly and devastating disease affecting more than 6 million Americans. I sought some clarity in the drug's hope and challenges from some of our best local experts.
A new year giving new hope to those of us who know well the Alzheimer's crisis. The FDA has given accelerated approval to a new drug, lecanemab, otherwise known as Leqembi.
I think anything that can slow decline in this disease, it's something that's very exciting for a behavioral neurologist such as myself.
Dr. Michael Rosenblum is clinical director for Health Partners Center for Memory and Aging. Rosenblum says what distinguishes this drug from the controversy of 2021, when a different Alzheimer's drug gained approval only to also garner major pushback, is simple results. In a study of 1,800 people with early Alzheimer's, those who got lecanemab for 18 months experienced 27% less decline in memory and thinking. Not to mention, Rosenblum says, lecanemab comes with less severe side effects.
And it's relatively safer in terms of these microhemorrhages and incidence of brain swelling. It's not perfect, but we see a trend in the right direction.
But Rosenblum does see a few red flags when it comes to those still significant side effects and the drug's cost, $26,500 per year. He urges careful consideration of who exactly would be getting the drug.
There is some evidence that if you're on a blood thinner or if you already have some microhemorrhages in the brain due to a condition known as amyloid angiopathy, these side effects will be more pronounced. In addition, genetics is a factor as well.
As for whether this drug should again be attacking amyloid, the Alzheimer's hallmark, Rosenblum says yes. After all, he says, it may end up as the first ingredient in a game-changing cocktail.
Drugs that affect the disease process at each stage, I think, will be beneficial. And if you look at the way we treat HIV right now, we have heart therapy where we have different drugs that act via different mechanisms to make a difference. And, HIV is a chronic disease that people live with. It doesn't progress to AIDS. And I see that as the future of Alzheimer's disease.
But back to the new year, bringing new hope.
What does 27% really mean for those people?
It means more time. It means days, weeks, months.
As the CEO of the local Alzheimer's Association chapter, Susan Perriott says families are following every drug development, weighing the side effects of the drugs versus the disease, and making decisions with loved ones and memories in mind.
It is definitely more time with people living in that early stage where they can still participate in all kinds they want to be part of. Time is so precious, as we know, and having the ability to be really active in your life during that time is really important for people with Alzheimer's disease.
So true. Well, Sue adds the cost of the drug must also be weighed against the cost of care for people with Alzheimer's in the later stages of the disease, which is significant. Still to come in April, the Centers for Medicare and Medicaid Services will decide whether to cover the drug's cost, and hospitals will then have to figure out how to manage the drug. But again, there's hope.